there is a factor called nuclear factor GABA. It is an inactive form. It triggers the formation of various cytokines. Normally, it is bound with inhibitory GABA. This is the small one, is the inhibitory GABA. What will happen is, this new antigens produces a substance called kinase, which cleaves the nuclear factor GABA from the inhibitory factor. The kinase cleaves the inhibitory factor. As a result, what happens is, the activated nuclear GABA enters the nucleus and results in the formation of various cytokines. The latest latest concept in the pathogenesis of inflammatory bowel disease. So, various substances, the antibiotics I have mentioned, A.S.A., steroids, anti-alpha-TNF, all act on these cytokines. But what is important thing is, our patients, most of them require only A.S.A. But if they do not respond, we have to go for steroid, immunomodulators like A.S.A.Jegannathan, mercaptopurine. If they don't respond with all these groups of drugs, then we have to go for biologics. If the patient does not respond to any drug, I think we have to resort to surgery. 5-HCA has got a hypersensitive reaction. It can affect the liver and kidney. It itself can produce diarrhea. So there are a lot of limitations. The most important thing is, many patients do not respond with A.S.A. Then we have to do steroid. Again, the steroid has got a lot of side effects, which I am not going to highlight, you know that. Then methotrexate is a very good immunomodulator. The problem is myelosuppression. And the most important thing is, it affects the liver. I have seen many patients developing abnormal liver enzymes. In the long run, some of them develop even fibrosis. The alpha-TNF, the problem is the flaring of the reactivation of the latent infection, especially in all populations. The tuberculosis may be reactivated. So, we have to be very careful using the infliximab. So, because of that, there is an urge to develop a newer drug. So, they have used this curcumin, as our Murugan has mentioned. There are a lot of properties, anti-inflammatory, antioxidant, and so many things. This curcumin, what happens? It prevents the activation of the nuclear factor GABA. It prevents the translocation of the NF-κB into the nucleus. Thereby, it prevents the release of inflammatory mediators. It's a newer concept, and they are developing this. They are adding this curcumin with mesalamine, and when it's given as a trial, there is suppression of the inflammation, achievement of clinical response, and endoscopic remission. All have been documented with the curcumin. The conventional manjal pudi, it is very difficult to administer because of some problems. Because when you have to achieve the real anti-inflammatory effect, you have to give a large amount, and its absorption, everything is limited. So they have modified this curcumin powder by a process called SMERS technology. And this SMERS technology improves the bioavailability of the curcumin. And there are other newer drugs which I am not going to highlight, but the company people want to highlight this curcumin. Probably it may come to the market and may produce a good response to the patient suffering from the inflammatory bowel disease. And finally, I want to mention about two other biologics. One is called natalizumab. This acts on the VACOM and MADCOM receptors. And as a result, what happens? The inflammation subsides. Then one more drug is called vedolizumab. Again, it acts on the MECOM receptors and suppresses the inflammatory process, inflammation in ulcerative colitis and Crohn's disease. So on one side we have the two emerging biologies, natalizumab and vedolizumab. They are not available in our country. We have only infliximab. But even infliximab produces some problems. So they want to bring out this newer drug that's called curcumin. And we have to wait and see the response of this newer drug. So I have expressed certain things highlighted. The inflammatory bowel disease is on the rise. The problem is very difficult to control because it's going to be a lifelong problem. Drugs may not be effective. Some of them require surgical intervention. With this, I conclude and I thank you very much for your patient listening.